Hi everyone, Dr. Ted O'Connell here. Just continuing my previous thought, and in this video I want to talk about oxygen needs in patients with COVID infection who are having respiratory issues, and even those who are not having respiratory issues. So in most pulmonary diseases, if somebody has a pneumonia or something like ARDS, which is acute respiratory distress syndrome, they'll come in with low oxygen saturations in many cases. Normal is 94 to 100%. When we see somebody lower than that, we put them on supplemental oxygen to help their bodies function better. And when we see an oxygen saturation below 90% in the medical field, we get really nervous about that because it can be a sign that they're going to go in the wrong direction and really need a lot of support and maybe even need to be put on a ventilator. The interesting thing about COVID infection is we're seeing people come in with dramatically low oxygen saturations, sometimes down in the 60% range, 70% range, which with many other infections is really incompatible with life. That means somebody that low is on the verge of death. And the interesting thing with some COVID infections is you will see somebody with really low oxygen saturations who's not short of breath, is able to talk with you, and it was just really low. And the concern there is what's happening in the background and what is that really low oxygen saturation, what kind of effect is that having on organs and cellular function and long-term implications for the brain. And that's part of what we're getting at. So in the next video, I'm going to talk a little bit about ways to address that.